Hi, this is Mr. Hove from Bluefin Vision. Today's video explains the risks and side effects of YAG laser capsulotomy. So first and foremost, YAG laser capsulotomy is a very safe procedure. Okay, it's done following lens replacement or cataract surgery, and the capsule, which holds the new plastic lens, has become opacified, thereby compromising the vision. The procedure takes 5 minutes. It makes a hole in the posterior capsule, and the patient is therefore able to see through that new hole and have a restored clarity of vision. The risks of the procedure are this. Because we're making a hole in the posterior capsule, fragments of that bag may be floating about in the eye after the procedure, which weren't there before the procedure. So patients will often notice new floaters in the immediate 2 to 3 weeks after the original procedure that weren't there before, but these almost always resolve. The next bit is, it is possible when you're having YAG capsulotomy for the laser that is being delivered, which is meant to be focused behind the lens, to occasionally hit the lens in the process, causing lens pits. These little marks on the lens do not affect the vision in any way, and the patient is not aware of them. The third thing to mention is that it is possible to get inflammation in the eye following a YAG laser capsulotomy, but typically we give the patient steroid drops for a week and the inflammation doesn't occur. And the last and perhaps most serious side effect is, after a YAG laser capsulotomy, it is possible to induce a posterior vitreous detachment. The vitreous is the jelly inside the eye, and as we get older, the jelly liquefies and eventually it collapses and pulls away from the retina. That in itself is a normal aging change which happens to everybody as they get older. It is possible after a YAG laser procedure to stimulate that process to occur, and in that process occurring where the jelly is pulled off the retina, it can tear or damage the retina, causing a retinal tear or a retinal detachment. Retinal detachments following YAG laser capsulotomy are incredibly rare. I've been doing ophthalmology for the best part of 23 years. I have only ever come across one patient who developed a retinal detachment following a YAG capsulotomy, which I didn't personally do, and that's in 23 years of practice. So though it's on the consent form that I get the patient to sign, it is incredibly rare. Thank you for your time.